KYKS, good morning. It is the Merrell in the Morning Show as we partner once again with our friends from St. Luke's Health Memorial in Lufkin. In the studio with us. Now, we've talked to this gentleman, several times over the past years that we've done this, at least 4 years. We have MONTE Bostwick, who is the market president and CEO of St. Luke's Health Memorial, East Texas. And welcome in again. It is great to see you.
Hey, it's good to be back with you.
Our friend that hails from New Mexico that has now made Lufkin his home for quite some time, and we appreciate you being here and having your services with us again. So let's get caught up on some of the things that have happened since the last time we talked last year. I know that we've got this partnership that's going on with the Heart Institute of East Texas. That continues. We'll kind of dive into that a little bit later on. But I know one of the things that's been a vision of yours is this this residency program for family medicine. Can you kind of dive into that?
Yeah, super excited about starting a family medicine residency program. This is something that really dates back to my arrival here, and we learned pretty quickly that there's needs for more physicians in rural areas, certainly here in Texas, and so having some experience with the residency program in a previous job, just kind of started taking those steps towards what would that look like? Is this something that we can do here? We know that physicians tend to stay in about a 90-mile radius wherever they train for their residency program. So our abilities to stand up a residency program just increase our chances of being able to have an appropriate level of primary care physicians in the market. And so that's what we set out after.
Okay, so kind of how does this build? How does this look? I think they have a residency for 1 year out of this market, then a couple of years here. Is that how it works?
Yeah, it's kind of a unique track, and it takes several partners in order to pull this off. But as it relates to the training program, it's what we call a rural residency track. And what that means is that we partner, in this case, with Baylor College of Medicine, which is one of the largest, if not the largest, training program in the country for all kinds of physicians. But we partner with them in this residency program where when the first year that the family medicine residents come in, they go down to Houston.
Right.
They spend a year down there. They'll do rotations within the Baylor system, Baylor St. Luke's Medical Center, Texas Children's, and they'll get exposure to things that are not as prevalent in rural areas. By example, that might look at like inpatient pediatrics. We just don't do a lot of that in East Texas.
Right.
And so they'll do rotations down in the first year, and then after that's complete, they'll come up here. They'll be here in July, and they'll spend the next 2 years here in this market doing their training.
Okay, and there's this first time out, a total of how many residents going to be doing this?
Yeah, so the program is set up to be a 3-3-3. So family medicine training is a 3-year-long process. And so when I say 3-3-3, that means 3 will be in the first year, and that's what we have right now. And then they'll move into their second year, and we will replace those 3 down in Houston next year. So eventually there'll be a total of 9 in the program with the opportunity to potentially expand.
And like you said, I would imagine like one of the goals is, since you mentioned that 90-mile radius of practicing where you train, that they would actually stay in this area.
Yeah, I kind of liken it as I talk to our partners in the medical community here. It's like a 3-year-long interview that we get to have with potential physicians that may want to be here in our community, and certainly for them as well. I mean, the benefit to them is they get to be here, interact with our community, engage, and they'll know whether they like it here after a couple of years. And that's just a much better partnership than, hey, you recruit somebody into the market. Do they stay or do they not? Is it a good fit for them or is it not?
Well, I'm sure they'll stay. We've talked to so many cardiologists say, hey, I love it here. That's the end game here. Now, let's also bring a name here, Dr. John Oglesby, who's out of San Augustine. Kind of talk about what his part is in this.
Yeah, so Dr. Oglesby's been a terrific partner in this. He, early on, as I mentioned, there's several people that it takes to make this go, but Dr. Oglesby was one that I approached about being the associate program director in this program, because yes, residents get here, but it's not just that. You've got to programmatically put things together, make sure certain things are in place. And Dr. Oglesby has always had a heart for teaching and training. He's done this both with medical students. He's done this with residents. And as he's been in St. Augustine now for 30 years as a family medicine physician, he's got a daughter that's in residency to become a family medicine physician. He has a heart for it. So I went and approached him, and I had my whole, I'm going to really figure out how to get him in. And I probably was 10 minutes in, and he was like, I'm in. Let's go.
I love it.
It was great.
Another thing we would talk about was the family medicine outpatient clinic. Can we talk about that too?
Yeah. So part of this program will include when you train in family medicine, you have what we call a continuity clinic, where the residents will have their own patient panel. So they will have patients that come into this clinic that are seen. We are preparing to. We'll get that opened up sometime in probably March with Dr. Oglesby to get patients flowing through there. And then July, when the residents get here, they'll be in that clinic seeing patients. They'll establish relationships with patients. They'll see a full spectrum of care from newborns all the way to those that are senior. And super excited about that. We have just redone a clinic on the campus there at the Caldwell building, and it's going to be fantastic.
So going back to the residents again, so we're in the midst of that first year. Is that correct? That started back in July.
That's right.
So they're in Houston. Then July 2023, they'll transition to the Lufkin area.
Yep.
And then, do their 2 years here. Like you said, there's already plans for the second and then the third year. What's the process of finding out who the three are going to be? I mean, how do you whittle that down?
Well, it was, again, it's quite a process, but one worthwhile. And what I would tell you is that, again, partnerships with Baylor College of Medicine truly play a role in this. But last year we went through, we did our match, and we matched very high in that process. And I won't go into the details of that, but it's not just a selection process where we select them. They also have to select us.
Right.
Okay. But with that said, in this second round, because the program is now out there, we had over 700 applications to our program.
Really? That's got to make you feel good.
Yeah, it was phenomenal. And then within that, you go through a process where you'll start to limit, because you can't interview 700 people. But we did interview roughly 30 people for our residency program, and again, the match process will take place first part of next month, I believe, and so we'll know then which three candidates we matched with in that. So fantastic. Yeah, super excited.
So obviously this is something that takes money, it takes funding, and some of that's coming from right here locally, correct?
Yeah, absolutely. Yeah. Nothing like this it is very challenging to take off on something like this without help. And funding is a big part of that. And right out the gate initially, the Temple Foundation was right there with us. And my conversations with them just to help us figure out whether or not something like this was possible to help. So we brought in an outside firm that really specializes in graduate medical education to help us evaluate our community, our medical staff, our funding, et cetera, to say, yes, can you or can you not do this? So that was step number one. And so they were fantastic. They did that. And from day one, they've been with us saying, we want this as well. We're supportive of this. It's important to East Texas that we have physicians in this area. And then also the Grum Foundation was also another one that came big to the table to help us with monies. And we've really used most of those monies towards the continuity clinic and getting it ready to welcome the residents and new patients, as well as the GME classroom space and training area that we'll be doing.
So yeah, congratulations on getting this going. I mean, that's fantastic. So let's talk about another program involving internists, if you don't mind talking about that.
Internist. Yes. As part of the GME program.
I got it.
So we're not, one of the things, as I mentioned earlier, when we brought the consulting firm in to help us understand what we have here as it relates to training residents, they identified it wasn't just family medicine that we could potentially do here. We could do more.
Yeah.
One of those being internal medicine. And that's an important one for us. Internal medicine is the jumping off spot for a number of subspecialties as well that we're eventually going to need to have more of in this community.
Sure. Uh-huh.
So yeah, that's the next one we're going to be looking at. It's probably a couple of years down the road. Our goal is to make sure our existing family medicine residents and that program is, well on its way, fully stable. And but we're already in conversations with Baylor College of Medicine about starting the internal medicine program.
When it comes to accreditations, commendations, awards, you get to the point where it's almost dynasty-like for St. Luke's Health Memorial. And, some people will sometimes just play, oh, here's another award, here's another accreditation. And we've spoken to some of the interviews earlier that this is something that's not just one of those ones where you apply and, there's a chance there's a lot of paperwork. There's a lot of due diligence. There's a lot of arduous work that goes into everything that you guys get. So with that kind of being set as a table here, let's talk about some of these, including, once again, I think was it the fourth consecutive year now that the hospital's been awarded the Heart Care Center of Excellence by the American College of Cardiologists?
Yeah, it's 4 years.
That's great.
And was at we were at the forefront of the very first one that was ever given. I think at the time we were one of the first 9 in the entire country to receive that award.
This is one of those where, like you said, 9 in the entire country, one of the very few in the state of Texas. So, and of course, obviously this is a major team effort.
Yeah. I try to remind myself as a leader to know when to get out of the way. And thankfully for me, this is that one of those areas where I need to get out of the way more often than not, because I have such a great team that drives this, from the Heart Institute and Dr. Bacciaretti and others that are part of that, to the team at the hospital and Jenny and Gemma and a host of other people. It truly does take a team. For me, I just stay out of the way and let them do what they do well. And this is the result of their efforts.
And so the awards are wonderful. Once again, it's the culmination of a lot of hard work, but it boils down to taking care of patients and saving lives, correct?
Yeah, absolutely. At the end of the day, that's what this is all about.
Right.
And, I would say that it's not every day that I hear of a story of the impact these programs have. But I would tell you it's often, and probably a host of them that never get made to me, or made known to me rather. But yeah, we hear of stories all the time where people either in the community write us letters or something gets back from feedback about, you saved my life.
Right.
And it's not always in an emergent standpoint, which is, really important. But certainly in just the ongoing education, outreach, encouragement to the communities that we serve to live healthy lifestyles and to take care of themselves in certain ways. And that's where a real impact is made as well.
And of course, you've done a lot of work in the regional area, in the regional markets. How does that help you grow here at the hub at Lufkin?
Yeah, again, it takes a team, a partnership. I've mentioned the Heart Institute. They are very proactive in getting out into the outlying areas, sure. and just by default, we're there as well. And so Lufkin is very unique in that it does serve as a hub. And so whenever I look at the 12-county area that we serve and roughly 220 to 230,000 people that live within that area, we certainly feel like that's us as well. So we don't just look at it and go, we're just going to take care of Lufkin or Angelina County. It's bigger than that.
Sure.
And proactively we're out there. We continue to look for opportunities to expand into other communities and how we can better serve them. But I think we've done pretty well thus far.
Oh, I think so. Yeah. Let's talk about some of the partnerships that you've made through the course of time here. Of course, one of those being with the board of directors. Let's elaborate on that.
Yeah. So our board, even from the very beginning, I've been here for just over 6 years. We've got some existing board members that have been here for the duration, as well as some new board members, and I'm always appreciative of just their support. They are highly supportive of our initiatives, certainly around the cardiac measures. I couldn't speak more highly of them.
Okay, and into the St. Luke's Health affiliation, and of course with the connections in Houston too.
Yeah, most hospitals these days are part of a larger network. We are very fortunate to be part of a network of facilities, not just within the Texas division, but within Common Spirit nationally. And for us, Baylor St. Luke's Medical Center being a quaternary facility, that consistently operates at the highest levels, having that connectivity, opportunities for training. There are going to be things that we don't do here in this market, or at least not yet, that they do. And having that partnership with facilities like that is really helpful to us.
We've touched a little bit on the affiliation and the work that we've done with Dr. Bosciaretti. We've done like I'm a part of this with the Heart Institute of East Texas. But let's dive a little bit deeper into that collaboration.
Yeah, as somebody that's been doing leadership in this type of role for now almost 20 years, I can tell you that it is a unique partnership that we have with the Heart Institute of East Texas. And I want to commend Dr. Bocciaretti, Dr. Kahn, and the entire team at the Heart Institute. Here, probably just maybe a couple months ago, did a 40-year celebration of their institution. If you have a chance to walk around within the Heart Institute building, you'll see 40 years of progression of cardiac services in this community. And kudos to them. It takes vision. It takes leadership to do that. I've only been here for 6 years, so a fragment of that, but it's special for me to be a part of it, and I'm looking forward to the future as well. And
then not to mention, also there's a lot of community events that you partner with them on.
Yeah, the Heart Walk, we've got some things like that. We've got this mega heart event coming up. We're constantly, and I'm not always, I go into some of the meetings like, they'll be laying out things that they're doing, the teaching, the education, the different communities, because it's not just here in Lufkin. Again, just get out of the way, Monty. Let them roll and do what they do.
Going back to the partnerships now, let's talk about the partnerships that you also have with some of the local physicians as well. Yeah, so
this community is very fortunate to have the community of physicians that we have. Something like the residency just wouldn't be possible without those partnerships that we have with the physicians. And, that was one of the key things as we looked at, can we do this? If we don't have the support of the medical community, we couldn't do it.
Right.
And so their willingness to say, yes, I want to be a part of this. Again, that's why we have it. And so just want to say a thank you to them across the board. They've stepped up. They don't know yet exactly what it means because we've never had it here. So it takes a leap of faith, of trust, of partnership with us to say, yes, let's do this. And them knowing that we got to do it together. So,
and you mentioned the support of the medical community and of course the leap of faith. And that's also something you've gotten from the community in general as well.
Yes, and going back to, I mentioned our board of directors in this, but other community members, I've talked about Temple and the Grum Foundation, but even beyond that, just people in the community that have come to know about the residents that are coming, them wanting to make sure, when are they coming? How can we help them? How can we support them better? And so these residents are going to have things afforded to them and structure and support that I would argue most residents don't get because of this community.
So we've talked about, the you can see the expansion of the hospital. You can certainly see the expansion of the medical technology and all the different life-saving techniques. And it all starts, with visions, like we were just talking about the vision that you had with this resident program. So what visions are next? What do you see happening next?
Well, thankfully for me, more often than not, the resident experts in the various places certainly in cardiac services, I depend upon those leaders to help me navigate what that's going to look like. Again, they're the resident experts. They see what's coming down the pipeline, where we need to be in the next 3 years, in the next 5 years. And really what I see my role is make sure, okay, what support do I need to have in place in order to help fulfill that vision? Now, with that said, we're going to continue to go down the line of building solid medical communities, not just here, but in the surrounding areas, to do our part in that, education, et cetera. And also, I'll just get a plug in here, also just the workforce in general. We need good people, nurses, techs, dietary, environmental services. There's a host of things that we want to continue to invest in. And that's a vision that I have. And we're going to have wonderful partners like Angelina College, SFA, et cetera, that we want to partner with to make that happen.
And do you have any final, do you want to expand upon that, or any final thoughts that you may have?
No, I'll leave it there. Just more to come. Next year when I come back, hopefully I'll have something else to say, hey, we talked about this last year and here's where we are right now.
And it'll be warmer, right?
It'll be warmer, absolutely.
All right. Thank you so much.
Awesome. Thank you.